Hi Dr. Rosliza and hi everyone. So today my friend and I want to share about stuttering. Do you know what is stuttering? Okay, actually stuttering, also known as stammering, is a speech disorder in which the flow of speech is disrupted by involuntary repetition and prolongation of sounds, syllables, words or phrases, as well as involuntary silent pause or blocks in which the person who stutters is unable or difficult to produce sound. Based on information from Ministry Health of Malaysia, usually children aged 2 to 5 years old experience a period of stuttering in the process of their language development. 5% of children experience normal stuttering at this age. The main factor that cause stuttering have not been identified yet, but some of the factors that are often associated with stuttering are genetic factor, development factor, and environmental factor. However, this speech disorder can be cured by intervention or therapy. The second therapy session is diaphragmatic breathing. People who stutter may develop poor breathing strategies as they struggle with block and repetition for many years. Quick and shallow breathings, gulping for air, or trying to squeeze out air due to their struggle with long-term disfluencies. So the technique will be like this. Place one of your hand on your chest and another one on your belly. Feel your mouth, jaw, and your throat and neck relax as you breathe out. So take a deep breath using your nose. Feel your belly rise and fullest extend. After that, breathe out all of air using your mouth slowly. Feel your belly fall and your diaphragm relax. One of the interventions I would like to share to all of you is fluency shaping approach. The main focus of fluency shaping intervention is to increase fluent speech through teaching such as a loose contact, changing breathing, prolonging sound or word, as well as other methods that reduce speaking rate. So the process of the intervention will be like this. Firstly, therapists will do assessment before the therapy session that will measure by two ways using different word score DWS and perception of stuttering inventory PSI. After that, the first therapy session will be conducted by slow speech or stretch syllabus technique. The first step to fluency shaping is mastering very deliberate and slow speaking. The typical rate recommended by speech-language pathologists can be around 40 to 60 syllables per minute. For example, break every word down to each syllables. The word of lemon will be broken down to le and mon. It will be like this. I like lemon. The third session or the last session I want to share is using light articulatory contact. While pronouncing words like put, butter, or pet, we have to bring our lips together briefly to produce the initial sound. This point contact can lead to blocks. So, light articulatory contact can help you overcome these blocks and move on with the word. So your first task is to determine which articulators you use to make a sound. For example, to say word ball, you are primarily using your lips to make the p sound. Next, you feel your mouth come into the position to say that sound. Make the lightest touch of your lips to make the p sound. Make the b sound and continue the word like pal. Pal. Lastly, after the dose of therapies, the therapist will do assessment again using the fluent word score and perception of stuttering inventory. This procedure is to determine the differences fluent speech before and after session. So, Next, I will pass to my friend Eileen.
Hi and greetings to Dr. Lisa. As we all know, there are a lot of programs as an intervention for stuttering disorder. The other intervention than fluency shaping approach is the Lidcombe program or LP. LP is one of the intervention or program that can help children with the stutter disorder. As we all know, most cases are happening in the childhood years. Kids has problem on their pronunciation and even to mention the daily simple words. So, in this video, I will describe and explain in details on how the procedure for this LP program. But before that, I will explain briefly on what is LP. Okay, LP is an intervention which is a direct approach by using a system of reward and incentive to the children with the disorder. In this technique, if the children succeed in pronouncing and speak a word fluently and perfectly, a reward such as praise will be given as an encouragement. As we all know, the operant conditioning is widely used to produce behavioral changes on an individual self. For this treatment, there are two stages, which are stage 1 is for treatment, while the stage 2 is for maintaining the changes behavior. On stage 1, parents and children will attend a speech clinic once a week, which is between 45 minutes to an hour. In addition, the treatment is given through structured conversation with the parents and the child, lasting about 10 to 15 minutes. The therapist and the pathologist involved will evaluate the structured conversation between the parents and the children. If they are satisfied with the assessment given, treatment will be continued with unstructured conversation between them. If the therapist and the pathologist are satisfied with both of conversation, treatment will be continued to the stage 2. For stage 2, usually the visit to clinic is about 30 minutes only. In addition, at the beginning of this level, the pathologist will assess and conduct the severity scale of the children's stuttering condition. Parents, therapists, and language pathologists will discuss the evaluation of the scale. It is because to ensure the parent to satisfy with their children's condition based on the scale that has been used. If the goal is achieved, which is the children could speak and pronounce fluently and perfectly, the therapist will schedule for this stage 2 current performance contingent. Lastly, in this stage 2, it will continue until the children reaches the goal, which is maintaining the performance around a year and so. If there are any relapse happen to the children, parents should contact the therapist and the clinic immediately for the repetition of the treatment. In my opinion, this therapy is quite simple and easy to understand, so it will ease the parent to follow the procedure properly and smoothly without any failure. The presence of the parent themselves really encourage the children throughout the treatment. That is all for the LP treatment. Thank you.
So today I would like to talk about DCM or Restart program, which is heavily based on the demands and capacity model. So just kind of a quick outline of the goal of this program is it suggests that positive changes in motoric, linguistic, social, emotional, or cognitive function in a child who stutters in the environment will lead to a reduction or recovery from stuttering. So this program aims to achieve a balance between demands of communication and the child capacities. Now I'm going to go over some of the treatment that involved with the DCM. So while I'm going over, this is really important to keep in mind with this big idea of the therapy that we enhance the positive changes positive change in the child. So for the first session, the parent and the child go to meet the therapist, and they are discussing any regarding issue of the stuttering that they might have on the child. And this understanding will also brought up from the test result from the evaluation form. So for this first session, the parents and the children will be test assessment scale of the environment's demand of the child. They will go about 10 to 15 minute video recording of a parent interaction form, which lay out an easy to use table for assessing the cognitive, motoric, linguistic or emotional demands present in the interaction. So in this interaction, the speech pathologist is evaluating this appearance, speech rate, their attitude towards the stutter, then turn-taking behavior abilities, and overall the type of interaction that occurs. And after that, the therapist will explain exactly what they mean and what type of observers that they have might see. Alright, what's so cool about this therapy, if after the first session, they will go home and bring up the logbook and the special time they need to have every 15 minutes a day to set aside for parent and their child to just stop to really set up on between any time they can have to speak in the same how they feel about. So the logbook is really just a dialogue for the parent to write down how they use the therapy at the home for their first 8 and 10 minutes, what they feel, what they do, everything that they do. And after that, the logbook will go back for the next session to the speech therapist, and they will evaluate what the parent do, and they will suggest what is the best thing to do after that. The first session, the parent will just mimic whatever they learn from the therapist at the first session at home, and just write all in the logbook what they observe, what they say, and that will be the evidence or the recording that they have to show to the therapist. So for the second parent session, so the second is really the time when we get down to the childbearing issue that might have happening. That type of behavior is the child showing to them what exactly the approach that we get to do to touch on this issue. So there are a lot of technique, which is such as reducing motoric demand, reducing linguistic demand, and reducing emotional demands, as well as reducing cognitive demands. Like all the 4 treatment I just say, so we go first with reducing motoric demands. It's allow the child enough time to say what he or she is wanting to say. It also decreases communication pressure for them and their speech rate, so it's good for them. So for example, you give anything for them to hold in their hand and just let them talk about it on the table. So this give their own time and pace to talk about it. For the second treatment is with reducing linguistic demands. So parallel talk can be helpful, and also using vocabulary within the child range and development age. And also with this, you have to watch your sentence structure. If you are saying vocabulary that no child of that age will understand, it will only adding pressure on the child. And we go to the third one, which is reducing emotional demands. For example, you have to show when they are talking and they are started for some reason, you need to show your emotion from your body movement or your body language, which is you can't show them that you are tired or you feel bored of their stuttering. So you just encourage them, be happy, and always listen to them. The last one, the fourth one, is the treatment that you need to use the reducing cognitive demands for them. So it can be achieved by focusing on what the child is saying and ask one question at a time. So this kind of situation can give their time or their own ability to not pressuring their cognitive process. Alright, let's say the child is still not showing any improvement. what will we do? So don't worry, the therapist will slowly bring in modification. So they would teach a more relaxed way of speaking, so the child will be teach slow, longer prolongation or softer repetition. Once they have created the least restrictive environment for the child and they meet all of their goals, and they will be set up an appointment every 3 months with the child for 21 months. This appointment will last for 30 minutes, so inshallah the child will sooner or later be better from this stuttering disorder. That's all.
We shall continue our presentation with conduct disorder. Conduct disorder is one of the mental disorders that diagnosed during the childhood years, which arises through repetitive and persistent pattern of behavior. In addition, if this behavior disorder is not treated in early childhood, it can have a negative effect when they are become adult, which is having antisocial personality disorder, engaging with crime, and committing violence. There are a lot of intervention to treat and modify this behavior, which is one of them a family-centered feedback-informed therapy, or I will call it short FT-FIT. This treatment has been established based on development in a family, systematic, scientific, and practical therapy. There are 4 phases in this FT-FIT intervention that I will discuss more about this. Phase 1 consists of 4 session treatment, which is session 1 until session 4. This is an early phase to focus on the family goals itself. Through this module, these first phases also elaborate on the problem solving focus, goals and objectives centered in the family. The second phase is known as the middle phase of the intervention. This phase consists of 10 phases, which is session 5 until session 10. The main focus is to develop strategies based on the solution and problem-solving focus. This strategy was practiced on parents and their problematic children. The third phase on this therapy consists of session 11 to 16. In this phase, the therapist together with the family will plan various future prevention to ensure there is no relapse occur after the treatment. The last phase for this intervention consists of session 17 to 20. This final phase focuses on formal closure of the therapy. This phase also focuses in strengthening the strategy on avoiding the repetition of this behavior. Follow-up treatment was performed to ensure the sample is consistent with the prosocial behavior without the presence of the delinquent behavior. 12 months of interval follow-up treatment period was carried out every 1, 3, 6, and 9 months after the end of the final phase and session. There are 10 scales and assessments that has been used during the intervention, which are Self-Report Delinquency Scale, SRD Scale, Alabama Parenting Questionnaire, Multisystemic Behavior Rating Scale, Parental Supervision Index, Offending Statistic, Goals Tracking Form, Session Rating Scale version 3.0, Fidelity Measure, and Therapy Support and Self-Care Rating Scale. That is all from Family-Centered Feedback-Informed Therapy. Thank you.
Thank you, Eileen, for sharing about family-centered feedback-informed therapy. The second intervention that can be used for treat conduct disorder children 3 to 12 years old is Internet-Based Parent Management Training Program, or it can call as PMT. Basically, this training will be attended by parents through the internet with the therapist. During the PMT program, parents are asked to register the kind homework they has engaged in on a weekly basis. The therapist will provide guidance and guidelines through the internet or online to the parent. The internet-based version spans 7 sessions distributed over 10 weeks. So, the first session to the fourth session focus on promoting positive behavior, while session 5 to session 7 focus on reducing negative behavior. The preparation before the program, parent will be provide the content-related information, video vignettes, and quiz-like part at the end of each session, where parents receive automated feedback on their response to multiple choice questions. After that, the first session will be conducted in 1 week to complete the task. The instruction to the parent is, parents need to spend more time with their children, playing in flexible and encouraging manner. Use direction of attention as a tool for changing their behavior. While the homework assignment is responsive playtime. Spend at least 15 minutes for this session with your child every day on the child's own condition. After finish this session, parents need to complete the feedback. Second session will be conducted in 1 week after the first session. The instruction to the parent is elementary behavior analysis is introduced. Prepare your child well in advance for upcoming events. Communicate a simple and direct way without nagging or yelling. The homework assignment is prepare and prompt. Two situations where you prepare your child and then request or demand something from them. After finish this session, parents need to complete the feedback again. Third session still be conducted in 1 week after the second session. The instruction to the parent is pay attention to and praise positive behavior. Learn different ways to praise effectively. So the homework assignment is highlight particular situation where you praise your child. After finish this session, as usual, parents need to complete the feedback. We move to the fourth session that will be conducted in 2 weeks after third session. The instruction to the parent is ways to introduce new routines. Create clear and understandable tasks. So the instructions are provided on how to administer a child and star reward system. The homework assignment is hand out tasks to your child every day. Tasks should be linked to praise or reward. After finish this session, parents need to complete the feedback again. Next, we move to the fifth session that will be conducted in 1 week. The instruction to the parent is extinguish negative behavior by paying less attention to them. Be assertive but calm when you decide to make a stand against a certain behavior. The homework assignment is ignoring misbehavior of your child, practicing on focusing away recurring their misbehavior. After finish this session, as usual, parents need to complete the feedback. Sixth session will be conducted in 1 week after the fifth session. The instruction to the parent is about problem solving. Parents need to formulate the problem and then brainstorm the solution. After that, agree on one and put it into action. The homework assignment is practicing about the problem solving. After finish this session, parents need to complete the feedback again. The last session will be conducted in 3 weeks after the sixth session. The instruction to the parent is being consistent about rules. Few things that parents need to do are withdrawing privilege or natural consequences. Parents need to remain calm in conflict, also using time out correctly. The homework assignment is practice time out correctly. After finish this session, as usually, parents need to complete the feedback. So that's all from me about internet-based parent management training program. I will pass to Shafiq to introduce next intervention.
Alright, thank you Aini. So now we move on to the last part, which is the last treatment for conduct behavior. So we call it contingency management or CM. This is a form of behavioral treatment which is quite popular and effective treatment towards this conduct behavior. So CM has been used for decades with different type of client to treat any kind of behavior problems such as It could use to smoking, eating disorder, or aggression, or any type of behavior. So other CM related terms that you may have heard is behavior modification, contingency contracting, token economy, or behavioral treatment. Contingency management. So what is it all about? So it involves a system of rewarding or punishing specific behavior in order to change those behavior over time. So what we can say is contingency or contingent means an event or condition that something might happen as a result for something else. Let me give you some quick example. So this is the parent and children situation, which is the parent is worried because it's annoying to bring their kid outside from their house because they are not behaving politely. So in order to do that, the parent said to their children like this: in order for me to get you to the theme park, you must behave politely when going outside, okay? Like that. So this will be an agreement between them for making this kind of behavior happen, that is, they need to be polite for them in order to go to the theme park. In another word, theme park itself is an agreement that they might have, and what makes this CM functioning is when the management part is being fulfilled by their parent, which refer to supervising or overseeing something. In the case of the CM, that would mean they need to make sure that their children is meeting their behavior to having the contingency. So to assure the requirement, behaving politely equal to the theme park agreement must be met. There are a lot of ways of doing this contingency management. There's a lot of skill, different of approach. So for me, I would like to present about star chart that are not complicated for the kid. This type of chart is similar to incentive chart of encouragement chart used in school to reward good behavior. As parenting strategy, we can use it to reinforce rule, chores, and responsibility to our kid. So providing an immediate reward for good behavior, in this case, acknowledgement through the tangible symbol like a star, followed by basic operand or Skinner principle, which is if you reinforce or reward a specific behavior, that behavior will increase in frequency. Conversely, if you do not reward a particular behavior, that behavior will decrease in frequency. So first of all, parents need to establishing the star chart incentive. This can be, they can learn this from their counselor or the clinician that diagnose their children with the conduct behavior. And CM, this contingency management, is much more powerful when the star can be exchanged for a small prize or incentive. Okay, in order to do this effectively, so there's a kind of question that you need to answer before you do the table, that you need to meet before you do it. So it's like, how many stars will each recovery behavior be worth? How many stars can each children get for each behavior? Will be their time frame for each star, and what value of assigned to each kind of star that they will have, and what is the price list and the price level of the behavior that they can redeem while they're making a good behavior. After doing all this planning, parents can start to talk out with their children to make this agreement, and discipline is a key for this program. Like I said earlier, it's called contingency management. If you simply give up or taking these treatments simply or likely, it will eventually make the unwanted behavior likely to happen or increase again, because the child find another way to get the reward and incentive while increasing the unwanted behavior. So make sure parents have to be disciplined and put a lot of patience for the best future for their children. So that's it. all about CM or contingency management for conduct behavior. As you can see, if the behavior or this issue still going on, then you need to go to the clinical setting again or to the therapist and ask them to make up a new kind of treatment, because like I said earlier, there's a lot of ways in doing contingency management, or there's something wrong in the parent's style or skill in doing it, so they need to ask for the professional to guide them. Thank you, Aini. Thank you, Eileen. And my lovely appreciation goes to Dr. Rosliza, my lecturer, for giving us such opportunity to involve in this assignment, and we got a lot from it. So for you guys who get a glimpse for this video, I hope it can give you insight for what you can do, and you may want to get a professional help is if someone near you or your family get into this kind of disorder for stuttering or kind of conduct disorder. So I hope it will help all of you there. So that's all from me. Assalamualaikum warahmatullahi wabarakatuh.